My name is Nada Sudhakan. I'm a pediatric surgeon, basically a surgeon for children. My special interest is in keyhole surgery in children. First of all, I like to talk about something that's identified antenatally. Antenatal diagnosis of conditions is very rare, but it can happen. And the incidence of such happening is anything between 1 in 3,000 births, and the pickup rate is almost as good as that. What are identified antenatally? For example, things that can happen in the chest or tummy or outside the body. For example, something that's found in the chest is like a congenital lung malformation or esophageal atresia, or even a problem with the diaphragm such as a diaphragmatic hernia. That's in the chest. Or in the tummy, could be cysts in the tummy, cysts from the liver, cysts from the bladder or the kidneys, or cysts from the ovaries in the child, girl child. What are the implications of these findings when identify antenatally? So I'll just go through a few of the common conditions that I am referred for counseling to new parents before a child is born. So for example, the conditions that are found antenatally in the chest, such as congenital cystic lung malformation, these are found in the 20-week scans. Obstetrician might find cysts in the lung and they may refer the parents to me for counseling. And basically, cysts in the lung may resolve by itself, or most of them do not, may need surgery when the child is born or much later. So these can be small cysts or maybe larger, and the antenatal diagnosis and the follow-up is very important, and this is done by the obstetrician. The other conditions such as esophageal atresia, where there is discontinuity of the esophagus, which is a tube joining the mouth to the stomach. The esophagus may be discontinued. Basically, it's not connected, and this needs to be identified soon after the child is born, and surgery is required because the child cannot feed. So these conditions, when identified antenatally, need to be monitored before the child is born, and when the child is born, needs to be delivered in a center where there's pediatric surgical services. The other condition that's identified in the chest is diaphragmatic hernia, whereby there's a hole in the diaphragm and the intestine or structures in the tummy is herniated and found in the chest. So like intestine or liver or spleen is in the chest. Most of these kids, when they are identified antenatally, they may do well and mostly do well, and they will survive. Very rarely would the condition be so severe that there is mortality before the child is born or soon after the child is born. So most parents need to be counseled and advised appropriately that the child has got good prognosis or good survival rate according to what's identified antenatally. And again, with a child with a diaphragmatic hernia, once the child is born, the child needs to be born in a unit where they are geared for diaphragmatic hernia, and there's a surgeon available. Other conditions in the tummy, for example, cysts of the kidneys or the bladder, is something that needs to be identified early, and again, born in a center where there is surgical services. Often they don't need immediate intervention or immediate surgery for these kind of conditions. However, the child needs a scan once the child is born, ultrasound scan usually, to confirm that there is something there that correlates with what is identified before the child is born. Conditions where there is cysts in the liver or cysts in the other parts of the tummy are also not that urgent, but they also need to be scanned soon after the child is born and appropriately seen by the surgeon. Other conditions such as abnormalities or cysts in the neck or the back of the child is also very rare, but again, the obstetrician will follow up your child as the child is growing during the antenatal period, and will liaise with a surgeon and the neonatal team before the child is born. And all these conditions ideally should have the child born in a unit where there is good pediatrician or neonatologist as well as a pediatric surgeon. Most conditions that I've mentioned are not fatal and are correctable. So it's best that you discuss with both your obstetrician and your pediatric surgeon before the child is born, so that you have an idea of what is expected before the child is born. So what's important for you to do is to liaise with your obstetrician during the pregnancy, and normally an anomaly scan is taken at about 20 weeks of your pregnancy. And following this, you are able to purchase insurance to cover your child. And lots of insurance companies are doing this for you. And it's important that you do this because a lot of conditions, when the child is born and it's not identified antenatally, is covered by the insurance. So by taking the insurance early, soon after you have your 20-week scan, it gives you a peace of mind that if there's something that's not identified antenatally at the 20-week scan, it is covered for your child once the child is born. For most of the conditions that I mentioned earlier, they are something that can be surgically corrected. And most of these conditions are identified antenatally, can be treated with the keyhole technique. What keyhole surgery is tiny incisions whereby a camera is inserted into the area, whether it's the chest or the tummy, and two other small incisions are made for the instruments to operate into the chest or the tummy instead of a big cut. And what happens then is that the incisions are tiny and there's hardly any cuts on the muscle, so there's no pain for the child.